Millions of Americans are gearing up to evaluate their health plan options this fall during the annual open enrollment season. But did you know that over half of millennials, now the largest group in the workforce, admit they don't understand their benefit selections? And among Medicare beneficiaries, approximately 70% say they had not compared coverage options during open enrollment. Experts say that a lack of understanding can result in less than ideal choices, and that can cause people to miss out on plans that might better suit their needs and possibly save them money. Here today to offer some tips on how to pick a health plan is Dr. Marigene Hartker, an internist and regional chief medical officer for UnitedHealthcare. So thanks for joining us today, Dr. Hartker. It sounds like a lot of Americans are having a hard time understanding healthcare terms and benefit options. For those who don't know, what is open enrollment?
Well, thank you for having me, Pete. So, great question. Open enrollment is a specific time period. And the reason why it's so ubiquitous now, why you're hearing terms about it, is because it typically occurs in the fall, between September and December. And it's actually where you can just sign up for healthcare. And there's different types of populations that can sign up and different times. So anyone who's in the workplace, you'll get an email from your work. If you are eligible for Medicare, open enrollment actually occurs in a very specific time frame. And if you're on the exchange, so you're an individual looking for insurance or a family looking for insurance, it's from November 1st to January 15th.
What are some tips that can help people pick the right plan or even save money on their health care?
Yeah, so I'm really glad you asked that question. Really important. So when you think about your healthcare plan, the things you should look for, number one, it's just like anything where you're paying for something monthly. Can you afford the premium, right? The premium is what you pay every month. And then what's the out-of-pocket maximum cost? So in other words, you're going to have to pay deductibles, premium, co-insurance. These are all terms that you can look up in justplainclear.com or medicaremadeclear.com. But these are out-of-pocket costs. This is the total amount you'll be responsible for the year. Is your primary care physician part of the plan that you're signing up for? That's a very important thing. And if you're on medications, you want to make sure those medications are covered or that you know what the costs are going to be. Some additional things you may want to think about if you are somebody that uses mental health benefits, you want to see what kind of coverage is available. And if you have concerns around specialty, dental, vision, hearing, you want to see if your plan is affiliated with a dental plan or with a vision or hearing plan. But also the other thing is for employers, certain employers will affiliate themselves with wellness programs. So those are things, especially if you love to exercise, that you want to look into.
Dr. Hartker, I feel like we've already learned a lot today. Where could people go for more information?
Yes. So UHC, which is short for UnitedHealthcare, UHCOpenEnrollment.com. And they will offer tips and recommendations for you.